both how do we get good quality health care, how do we get it for a reasonable cost, and how do we, as Bill just mentioned, how do we make sure that it's actually resulting in healthier people, not just being healthcare for healthcare. I think one of the problems when you look at healthcare, it is a gigantic part of our economy. It's just huge. This is a huge piece of what we have here. And this is, if you look at all the spending that happens on the private sector, that businesses spend, that individuals spend, that the government spends on healthcare, this is more than we spend on national defense. It's huge. And it's fractured. A lot of people who have a stake in that.
Right.
Obviously, the public, consumers, patients, but also doctors, insurance companies, insurance brokers, pharmaceutical companies, pharmaceutical sales reps. This is a huge piece of our economy, and there's a lot of people who have a stake in the outcome. And you want to make sure that the results and the recommendations that come out are really on what's really best for patients, not what's best for drug company bottom line.
I think Laura put her finger on it. There are important stakeholders with important economic interests. Historically, the American Medical Association has been opposed to comprehensive health reform. I think they were joined in the 1990s by large insurance companies, large drug companies, who felt that reform was going to be counter to their interests.
And there's some areas of the country that have really leapt ahead and shown. For example, I think what's coming up a lot is we've got some really neat examples of care working really well for people, say, at the Mayo Clinic or at the Intermountain Health System in Utah, or even right here in Portland at the Richmond Clinic. Some states have done pieces of that. So, for example, in Massachusetts, there's guaranteed issue. So you apply for health care coverage, you get it. So there's different states approach it in different ways. Doing this nationally is a really smart way to do it. Oregon's congressional delegation has really stepped up, and everyone in the delegation has played a tremendous role. Senator Wyden, Senator Merkley, Representative Schrader, Representative Blumenauer have all played a really big role in helping to shape all of these different pieces of legislation, are advocating for the strongest piece possible. And at the end of the day, we have got to get a bill. We're paying a lot for health care, but our results just really aren't as good. So there's a lot of waste that we ought to be cutting. At the same time, for the money we're putting in, we ought to be able to get better care and for more people. All of the bills would stop the practice of denying people coverage due to pre-existing conditions. It would also stop the practice of charging more to people because of pre-existing conditions, or saying, yeah, we'll cover you, except not for that pesky pre-existing condition you have. To too much of an extent, insurance companies compete with one another not on costs, not on how great their plans are at keeping people healthy, but how smart their plan is at figuring out who's sick and not covering those people. That's what they're competing on. That's not helping anyone. Mm-hmm. The bill begins to shift those incentives, getting rid of the incentives that are encouraging too much of one kind of care and shifting it over so that we're able to focus. This is really key, together with knowing what care really works. We can actually get incentives in the right way so that doctors and patients can line up and get the best care for the patient. Setting an insurer efficiency standard, which is a key piece. Just saying, many insurers do a pretty good job of only spending a certain amount on administration, on paperwork. Some actually spend a lot of money on paperwork, and it drives up the cost of insurance. What this efficiency standard would say is, a certain percentage of the money you've taken in premiums, only a certain percentage can go to administration. The rest of it, at least, has to go to actually providing care, as opposed. There's a lot that's broken that we've got to solve. In terms, there's a lot of waste in the healthcare system. There's a lot of ways where we should be getting more bang for our buck.